Hello, everybody. My name is Dr. Tread Rissacher, and I am the doctor, the owner, and a client at my Dr. Tread's Slim Body Laser Spa. There's been a lot of talk about these GLP-1 drugs, and I have a new term. I call it GLP-1 done right. Okay? There's no doubt that the GLP-1 drugs are literally taking over weight loss and people that are trying to lower the A1C numbers. So I'm going to go over some statistics here about the GLP-1 drugs, and so you can understand how much it is becoming commonplace. And also, I have a solution at the Slim Body Laser Spa that we can use the GLP-1 drug. You can get it prescribed right at my office with a partner that I'm working with who's a prescriber who can prescribe the GLP-1 drug. And then with our guidance and counseling and monitoring of your weight loss and your body sculpting at the same time, we can get a better result from your GLP-1 results because we can treat the subcutaneous fat at the same time that you're losing weight. So I'm going to go over that a little bit here in just a second. So here's some statistics, okay? The GLP-1 drugs are drugs, they're called semaglutide, and these are peptides or proteins that your body produces in response to digestion, whether you need to eat or not eat. It satiates your desire to eat. It's something which is a receptor that is in your intestinal wall. And when you're eating food and you get enough food in your belly, it sends a message to the brain to tell you to stop eating. And that's called a glucagon-like peptide, a GLP-1. And it works great as long as you have food and you're eating food. The problem with GLP-1s are they were never designed to be given to take every single day. And for that reason, it is stopping you from eating food. And you say to yourself, well, is that the same thing as fasting? No, it's not, okay? Because when you fast and you go without calories, you do not have the GLP-1 initiating any physiological reactions that are abnormal. See, when you fast, your body preserves lean muscle. It preserves your overall vital organs and your bone density. And that's because, and then what it does is fasting will find calories in other areas, in other ways. One is folded proteins, senescent cells, something called phagocytosis, and it strives to preserve your muscle tone. And the GLP-1, since it's not the same as starving, you're taking this drug, what happens is your body is not able to preserve the muscle tone like it would if it was just going through like fasting, okay? So let's just talk about how popular they are, okay? GLP-1 drug is called, one of them is called Ozempic or Wegovy. Another one's called tirzepatide, Mounjaro, and Zepbound. And the difference between these drugs are basically the dosage, how strong they are, okay? Now, they've exploded in popularity, and they are now far outpacing traditional weight loss centers, okay? Programs like Jenny Craig, Weight Watchers, Nutrisystem, Quick Weight Loss, they are almost gone. Well, they're all gone except for Weight Watchers because they're using the GLP-1s there, but their traditional weight centers are absolutely out of business, okay? And that's really an amazing thing that they could become that popular that fast, because we know about traditional weight loss and those, eating less and exercising more and being more mindful is really the real solution for overall weight loss and healthy way. Yet those companies are out. Everybody is doing GLP-1, okay? And this is how popular it is. Right now, from the 2025 to 2026 data, which is only, 3 months into 26, the current usage is 1 in 8 adults are using a GLP-1 for weight loss or for blood sugar control. That's roughly 12% of our population. And the poll from last year in 2024 When they were available, it was 6% were taking it for weight loss, diabetes, or related conditions. That is a huge jump. That's a 100% jump. Okay, now the lifetime use, nearly 1 in 5 adults have taken a GLP at some point, 1 out of 5. The estimates are around 10 million Americans are on GLP-1s in 2025, with projections for significant growth in 2026 due to lower prices. It's getting more affordable. And also oral versions. They've now come up with a new pill called the Wegovy pill. It was approved in late 2025, and now Medicare, Medicaid coverage expansions are beginning in 2026. Some forecasts suggest the use of Wegovy as the pill will be, and other ways, is going to be over 25 to 30 million people will be taking it in America by 2030. That's an explosive growth. The GLP-1 obesity drug market has hit tens of billions in revenues. Eli Lilly Mounjaro alone generated $39 billion in the first 9 months of 2025, surpassing many top drugs that have been around forever, statins, antidepressants. They're more than that. Okay, the global projections are going to reach between 100 to 200 billion dollars by 2030, with the U.S. leading in these numbers. Over half of Americans hear about these drugs extremely very often, with massive media and social discussion. Hashtags, celebrity use, economic impacts like reduced fast food visits. So when you compare traditional weight loss center programs, a traditional center would be a structured diet plan, group coaching, or meal replacements. They have declined in relative dominance. These programs historically served millions, but relied on behavioral changes with modest average results. So you can expect a 5 to a 10% weight loss and a high regain rate, meaning you get the fat back. I think it's like less than 2 or 3% get the fat back in these traditional behavioral type weight loss, the historic programs. Today, the GLP-1 delivers a 10 to a 20% sustained loss. Unreal. The real world is 7 to 12% after a year. This is making them more effective and more appealing. Many users shift or combine with traditional methods. No direct head-to-head numbers show GLP-1 users dwarfing traditional program participants in recent years, but the market reports describe GLP-1 as disruptive, shifting obesity treatment from lifestyle only to medically assisted. Demand for traditional centers has likely softened as people opt for pharmacological options since they are easier, they're more predictable, and the results despite the costs and the side effects. So for that reason, it's really important to understand that the GLP-1 are dominant force right now in weight management, and they are transforming it from a slow effort, heavy traditional paths or spot treatments to a medical high efficacy, meaning, proper, according to them, option. Traditional centers and body sculpting do persist, especially for maintenance or targeted needs, but the GLP-1 adoption has surged ahead dramatically in the last couple of years. All right, so if you're in the Port St. Lucie area or the Stuart area and you're considering options when it comes to GLP-1, many local wellness and integrated wellness centers, such as mine, my Slim Body Laser Spa, is now offering the GLP-1 medication, and also with a program of traditional sculpting services along with the GLP-1. And we call it GLP-1 done properly. And what does that mean, or done right? It's important to understand why why we're doing this, why I've decided to do this. I've been in practice at the Slim Body Laser Spa for 17 years. We have always recommended nutritional recommendations, weight loss programs, more exercise, more sunlight, eating clean, detoxification, whole body vibration, and also the use of low level laser technology, which is in the wavelength of red 628, in order to shrink and to reduce subcutaneous fat, tighten the chin, get rid of back fat, tighten your legs. It's been very, very successful for many years. But the biggest problem we have when it comes to using these non-invasive body sculpting outside approaches is if a person cannot control their appetite or they cannot control their intake of food, our procedure does not work as well, obviously, because they're eating faster than the machine can shrink and get the weight off. So we work very hard on getting people to make better choices, and we don't charge extra for that. And what happened is I've always been a little negative about the GLP-1s. They came on real fast. I've been in practice for a long time, 37 years, and I've seen a lot of weight loss drugs come and go. I watch Fetterman, they still give Fettermine. For every weight loss drug that has ever been put on the market, most of them have been taken off because they're just plain old unsafe. A lot of them are appetite suppressants, which suppress your appetite, and they typically do it with speeding up with things like barbiturates, something to amphetamines. Barbiturates slow things down. Amphetamines, so you are overclocking, and we know that that's not healthy at all. And then, and people have been in trouble. So when I saw the GLP-1, I realized that it really works for people. I mean, there's no doubt about it. I'm telling you, it does work. However, you should understand a lot about how the drug works, why it works, and ways that you can mitigate and control bad reactions and problems from these drugs. And one of my biggest criticisms of the GLP-1 drugs are you can buy them online, you can have a telemed that'll prescribe them for you, or the doctor gives them to you, and they don't know squat about nutrition. They don't understand about exactly how the GLP-1 works. They follow the prescribing guidelines, and oftentimes a person can get sick because most people need more help than just the GLP-1. So the way that we can help with GLP-1, and we call it GLP-1 done right, is that the way a GLP-1 works is it basically stops you from eating. And since it's something that you take every single day, it's not just a one-time release by your body, which is the way most hormones come out. Your body releases them, and then they go away, and then they release them again, then they go away. You're taking this in a way that it's titrating, where you have a lot of it in your system every single day for as long as you're taking it. And that creates a situation where your body no longer is getting the right amount of calories it needs to maintain something called your basal metabolic rate. Now, your basal metabolic rate is a big word for how many calories you need to eat every day just to maintain and sustain your level of body fat, your level of muscle tone, and your activity at your age, weight, and height. Now, the way we calculate BMR is, suppose you were to fall asleep. Suppose you were to be in the hospital for one day, and you're in bed. They didn't feed you and you did not exercise. Okay, you're laying in a hospital bed for 24 hours. You're alive. Your body is producing urine. You're rolling over. You're complaining. You're burning calories from inside. The amount of calories that you burn in that 24-hour window is called your basal metabolic rate. And for most of you, if you're under 50, your BMR might be 2,000, 2,200. If you're of a normal weight, you're not too overfatted. If you're very muscular, your BMR could be as high as 3,000 or 4,000. Okay? My BMR, when I started my weight loss journey, I was 52 years old. I weighed 265 pounds, and my BMR was 2,400 calories. And that means If I eat 2,400 calories every day and I want to lose weight, nothing's really going to change for me or for you if you eat your BMR. So in order to be successful at losing weight, you need to know your BMR, okay? So that's the first very important factor. Now, when you take a GLP-1 and it's done consistently over time, your body no longer is able, you're not able to eat enough food to make your BMR. So let's say you're eating, your BMR is 2,000 calories. The drug, the GLP-1, is stopping you eating at 1,000 calories. That's all you can put in your belly because you feel full, you feel a little bloated. You know, it shuts off the desire to keep eating, which is why you lose weight. But what happens is that other 1,000 calories has to be provided to your body for you to match your BMR. In other words, you have to have that extra calories. So what your body does is, yes, it burns a little bit of fat to get it. But more than fat, it burns what they call lean mass. Now, lean mass is everything that is not fat. And that would be muscle, bone, organ, and other areas that you might have some lean tissue that's not fat. And those calories are basically cannibalized by your body in order to make up that BMR. So remember, your BMR is 2,000. The GLP-1 is only letting you eat 1,000. So the other 1,000 calories are coming from this lean mass. And that would be fine if it were for 2 or 3 days or 4 days. It wouldn't be a crisis. But when you do it for weeks on, 3 weeks, 3 months, 6 months, what happens is your muscle tone goes way, way down. It starts to cannibalize the muscle tone. Everybody knows that about Ozempic. It's called Ozempic face. It's called, you look like you're losing muscle, and you are, okay? Now, you are losing some fat, just like weight loss does. But since the GLP-1 is really stopping you from eating when you're on weight loss, your body's still preserving muscle. But on GLP-1, it's not. And this is where people get into trouble. Because if you're under 50 years old and you're on a GLP-1 for more than 1 month or 2 or 3 months, you've lost a considerable amount of muscle tone. Unless you're exercising a lot, eating protein a lot. That can offset it when you're 50 and under. But when you're over 50, in the 60s and 70s and 80s, exercising and forcing yourself to eat protein, because remember, you're not hungry, the GLP-1 stopped you from eating, what happens is your muscle tone is not going to come back as easily, and you get into your late 60s and 70s, it's not coming back ever. The muscle tone that you bring in from your 20s and 30s, if you're very active physically, is the muscle tone you have when you're in your 50s and 60s. You don't build muscle tone when you're in your 60s and 70s like you did when you're younger. So this is a dilemma for people. You're on the GLP-1, you dropped 30, 40 pounds, you're happy as can be, but what's happening is you're becoming overfatted and your muscle tone has decreased. So here's our solution. When we use these red light low-level lasers, by the way, these machines are FDA cleared, they're FDA approved, and what they were used for was to pre-treat subcutaneous fat, and by definition, subcutaneous fat is the fat that's on the outside of your body, just under your skin, in front of your muscles. You know, the squishy stuff, the stuff you can squeeze. Sometimes you get it under your chin, sometimes it's hanging off your arms. It's the outer fat. It's not visceral fat, and it's accumulative, and it's there for the ride. You're going to die with it. What these lasers allow us to do in a series of a 30-minute laser session where we move these paddles around over those fatty areas, they open up the fat cells, they pierce, without damaging the tissue, the fat cell. Water, glycerol, and free fatty acids are released into the interstitial space. In 30 minutes, it equals 400 to 600 calories of fatty acids. That's fat, my friends. That's not stored energy. That's not muscles being digested by your body. That's fat that you've been carrying on the outside of your body, now being available to your body and your body then will use something called a whole body vibration plate, and that's going to move you gently, and basically it irritates the interstitial space and it pushes the fat into the bloodstream. Now you have another 400 to 600 calories available to your body to make up that BMR deficit. And you're burning fat and tightening and toning the outer fat at the exact same time. Think about that. Remember, GLP-1 causes you to eat less on your BMR. So you're living with 1,000 or 500 calorie deficit, which the body is making up by using some fat, but mainly muscle and lean mass. When you come into use this process, this GLP-1 done right at the Slim Body Laser Spa, we can use the laser to release these extra calories from your subcutaneous compartment. It's almost like a fanny pack that you got on the front of your belly. And those calories make up the difference of the BMR that you're losing because of the GLP-1. And I call it losing weight with GLP-1, tightening and toning at the same time. You should not, most likely will not, end up with Ozempic face because you're getting the calories from the outer compartment. And believe me, that outer compartment, you are never going to open up those fat cells once you're over 50 or 60. You're going to die with that stuff because it's a hormonal connection to it. The only time you can burn outer fat is when you have good high testosterone and you're a man, you're exercising, or in a female, you still got progesterone. You haven't reached menopause yet. Once you reach menopause and your progesterone levels have gone way down, you're what we call estrogen dominant, and estrogen dominance creates the subcutaneous fat compartment. And since we're getting older and we're not going to change our hormones that much, that fat becomes a stuck-on layer that does not go away. And the biggest challenge we've had at the Slim Body over 17 years of helping people is trying to get somebody to eat enough less that they can actually burn those calories when the laser releases the calories. And we do very good at it. But you know what? Taking a GLP-1 as an appetite suppressant and then using the laser to release these extra caloric load, we call it a bolus, absolutely perfect. I'm very positive and confident that this will help. I know this. We're just getting started. We do have a prescriber. We are doing the GLP-1, and we're not doing it unless you're willing to come in for the whole program, okay? And if you're interested in finding out more, if you want to see if you're a good candidate, you give us a call. Dr. Tread's Slim Body Laser Spa. Down below, there'll be some numbers you can call and do it. And I'm hoping that we can help people not become medically challenged and being sick as a result of the GLP-1. I also believe that it's a great off-ramp. If you've been on the GLP-1 for some time and you're starting to look bad and you're getting too thin and you're getting loose, areas, as long as there's still some body fat in the subcutaneous, you haven't burned it all off yet, we can help tighten and tone that also. All right. Again, my name is Dr. Tread. I'm a licensed chiropractor. We're doing the real thing here, all right? Have a great day. Thank you so much. God bless.